Panic disorder, panic attack causes, symptoms, diagnosis, treatment, and pathology. Panic disorders actually talks about panic attacks. What are panic attacks? These are intense fear, something bad will happen, a threat or a danger perception by a person, and it also associates with physiological symptoms, palpitations, dizziness, shortness of breath. These symptoms normally last for 10 to 15 minutes, but in some people it can last for hours together. It gives you a feeling like a heart attack, and it can happen in the familiar places. It is unpredictable where it can happen. It's only a clear symptom of anxiety. Now, panic attack is, as per the Diagnostic and Statistical Manual for Mental Disorder DSM-5, very clearly defined if 4 out of 13 symptoms are confirmed, like a pounding or a fast heart rate, chest pain, sweating, trembling, shortness of breath, nausea, dizziness, chills, numbness, feeling of choking, feelings of detachment, fear of losing control, fear of death. Any of these, if you just have 4 symptoms, all of them can happen together or in combination. Some are physical symptoms and some of them are mental symptoms. Sometimes it could be a combination of physical as well as the symptoms of thoughts and ideas. Panic attack is a very clear depressive disorder indication, or it can be a stress disorder, or it can be substance disorder. Panic disorder actually is from the recurrent panic attacks, unexpected. DSM-5 has a very clear criteria about it, that it is something which is a persistent worry or change in behavior. It is the effects of the substances, the drugs, the medications, anything. It could also be another disorder like agoraphobia or social anxiety disorder. So we really need to know what is unexpected. You can't predict, it can happen anytime. Very important is to understand the avoidance. It could happen at any place. So it's not a place oriented. Sometimes in a garden, it could be while driving, it could be in the lift, it could be a temporary relief. But one need to understand that makes daily life very, very hard. Researchers have really very clearly shown that panic attacks are very clear anticipatory anxiety. That person is worried about it can happen any place, and their endurance for this attack, they like to be all alone by themselves. Agoraphobia is basically when a person gets the panic. It's researched and found that the women are twice as common having these panic disorders than the men. It runs in the families. It is because of the genetic disorder. The treatment, of course, is psychotherapy or medication. When we talk of psychotherapy, we talk of cognitive behavior therapy. So to understand, to learn more about it, when does it happen, and then to maintain a diary and monitor it. Of course, breathing and relaxation is a big help. Changing the belief system, the fear and the phobia which suddenly appear into and then leads to the kind of the panic is important. And what kind of an exposure create that panic disorder is important to understand. Of course, there are the medication like antidepressants which help in controlling, or anti-anxiety drugs. They also support in relaxing and calming down the person. But this may lead to some kind of an unwanted effects. So it's better to avoid medication. But sometimes, even the anti-seizure medication is given when the person is having regular panic disorder. So treatment is very simple and clear, but the best is the psychotherapy. Thank you very much.